there. I hear you're having some difficulty with a headache right now. Okay, well, I would love to help you address that and hopefully lessen the headache, if not get rid of it, and to figure out what kind of headache you have to best ascertain what treatment is going to work for you. I'm going to start by locating the general parameters of your headache. So, from your perspective, where do you think the headache is starting? Is it starting in the temples? Is it like an ice pick headache right inside the eyes? Is it a full head ache? Where does that originate for you? Okay, good to know. And does it radiate at all? Are there other places in the head or the neck that you feel that go into? Okay, so I'd like to just jump right in, and I want to palpate around and see if we can find the origin and how far it spreads. From this point forward, I am going to need to be touching you for that. Is that okay with you? I have your consent to do that. Wonderful. Now, if you could please tell me when you feel pain and discomfort and when it is worse, that would be really helpful, okay? So I'm just going to do kind of an all-around feel. And I'm going to be gentle, firstly, but it still might be a little uncomfortable. And then we're also going to do some accentuation after I'm done here with mapping out the headache. And that is probably not going to be very comfortable, but that's going to tell me a lot about our kind of headache. Do you know if there was any particular trigger to this headache? Headaches can be caused by so many things, unfortunately. Yeah. I mean, it can be dehydration, too much sodium, can be overstimulation, exhaustion. A big one we see is muscle tension, especially with the temporomandibular joint. And do you have a history of migraine at all? Okay. Good to know. We want to make sure that what we're dealing with is a headache rather than a migraine, because those are going to be different treatments here. So is any of this in particular painful, uncomfortable? Okay. So I'm going to come more to the back of the head, and we're going to work on the top, the sides, and even into the neck. Sometimes we can get it radiate into the neck and the shoulders, the top of the back. Okay. Right back in here. Okay. And I'm going to ask a few questions here. So, how would you describe your posture, do you think? Okay, certainly could be better. All right. Do you tend to crane the neck forward as opposed to just looking down using the little hinge here? Okay, yeah, a lot of us do. It's really difficult to not do, especially unconsciously. And it feels like if you catch yourself doing it, try to readjust. The next moment you've gone back to it and you don't even know it. And have you had any recent illnesses? Any infections? Okay, and how has stress levels been lately? Do you have issues with sensory overstimulation? This could be one kind, multiple kinds, or even all kinds. Some people get really overstimulated with certain sounds. Some people smells, tastes, bright lights, things like that, or moving things even. Multiple colors. Okay. All right, so I'm going to do some accentuation here. And that means we're going to try to elicit what is making your headache. We're going to try to make it a little worse. And as soon as it is, let me know. We can immediately back off, okay? So for example, I'm going to do some direct percussion on these sinuses. If you have a sinus infection or sinus issues, this is not going to feel nice. It's not going to feel very good at all. But as soon as you let me know that, I can back off and we can move to treatment, okay? All right, so let's start with the sinuses. So here we have the frontal sinuses right at the forehead, the frontal bone here. We have the ethmoid sinuses right in here around the ethmoid. And we have the maxillary sinuses where the maxilla is, that maxillary area. So I'm going to first press down and release. Press, release, press, release. How is this feeling? Okay, and what about right in the ethmoid area, right around the nose? Okay, and we'll get to the maxillary area. How was that? Not too bad. We're going to do some of that tapping then. Let's see, how is this? Okay, not too bad. Not too bad. Not too bad. Okay, so probably we're not dealing with a sinus headache. Now I am going to be pressing in on certain parts of your head, and that might make it worse, but it also might make it better. So we're going to watch for that and see if there is any change in your headache. So I'm going to press in here. Okay, here. Okay. Right, and if I get a bit of a roll here, and we're going to get into the temporomandibular joint here. And I'm going to have you clench your jaw in a moment. We're going to see if this makes it worse. Okay, so I'm going to have you clench the jaw, unclench, clench, unclench, clench. Good. And how is that? Okay, so that kind of targets the masseter and a little bit of the TMJ there, but we're going to actually work with the joint itself. So I'm going to have you open the jaw, close the jaw, open, close, open, close. Okay, and how was that? Not too bad. Okay, good. So maybe not this area. We might have to look a little more into it. So now we're going to work more around the head. So I'm going to press in on the top of the head here. Release. Press. Release. How are we doing with that? Okay, now I'm going to come down more by the neck here. We're going to press, release, and release. Okay, and how was that? Alright, that made it a little better. So if I do right in here and hold that, how is that? Okay, good. So that's a good clue. Now finally, I want to do a little range of movement. Sometimes when we have muscle tension, a pinched nerve, or just some sort of issue in the muscle, injury, things like that, if we try to look one way or go up or down, we might get an increase in the pain or discomfort. So I'm going to try to move your head a little bit passively, if that's okay. All right, give me just a moment. And I'm just going to steady myself here on you, so that I don't all of a sudden I'm not holding on to you when I should be. Okay, so let's start by turning to the side. Okay, and let's turn to the other side. How is this? Okay. And let's go up a little bit. Okay, and let's come down a bit. Good, and now I'm going to tilt your head. So we're going to go to one side. And then to the other. How is that? Okay, let me go ahead and just get you back into place and make sure this is all stable and everything looks good there. Okay, so how was that? Okay, maybe a little bit of discomfort. In what particular movement? Alright, and would you mind just doing that for me as best as you can? Turning to one side, the other. Just noting if there's any restriction or if there's a certain place when you're turning that you feel any pain. For for example, maybe you turn your head to the side, but when you get to right here, you feel pain. Not so much here or at neutral, but in an in-between spot. Let's do a couple of active turns. Okay, and how about a tuck and looking up? Do that a few times. Okay, and then the tilt and the other side. My neck just cracked a bit there. Apparently I needed that. Just a couple of tilts here. And how was that? Okay, so any pain or restriction in any of those while you're doing it actively? Okay, good to know. Now I'm going to be doing a last little accentuation where I'm going to take this Penlight and I'm just going to shine a little light in your eyes. See if we have any light sensitivity. So it is quite weak, but for some people the general lighting isn't a big deal or it's manageable. But then if they have a direct light in their eyes, that makes it a lot worse. So let me know, and then I can immediately stop. Okay. Doing all right here? Okay, good. And have you had any issue with dry eye at all? Or should you be wearing glasses or contacts and you're not? Or are you having issues with glasses or contacts? Okay. Yeah, for some people, having dry eyes can trigger a headache, or the extra work that one's eyes have to do to see something straight. Maybe you have to squint a lot. That can also trigger a headache. So now let's check just a couple other things. So I'm going to take a peek into your ears. I just want to see if there might be any issue with a cerumen buildup, for example, or any signs of infection, as that can possibly trigger a headache, especially if you're really straining to hear something, for example. So I'm just going to take a peek in your ears. Pull up and back. And we'll just look at the inside of the ear. So I'm looking for if there's anything that might be making you feel unwell, essentially. Anything that might be making you strain. Anything that could be causing a headache as a symptom. And then if that is, then we can address that. Hopefully that headache goes away, right? Okay, let's look at the other ear. There we go. And I want to look at the condition of the ear canal as well as the tympanic membrane. And this will tell me if there's any blockage or discharge, any bulging in the temporal membrane. Good. And have you noticed any issues with your hearing lately? Whether things sound much louder, are we maybe having an oversensitivity issue, or do things sound much softer? Okay. And does anything sound garbled? Are we having any processing issues? Like you can hear fine, but it takes you a couple moments to understand what's being said. Okay. All right, so let's move on. And I'm going to have a very sort of surface level look at your hydration. So first I want to look inside your mouth. So if you could stick out your tongue here. And I'm just going to look around the mouth, because that can tell us a little bit about your hydration levels, especially the tongue. The tongue can get kind of swollen, or you can have the presence of scallop marks on the side of the tongue where it's swollen against the teeth. And that can tell us that maybe you're dehydrated, which headaches are a pretty notable sign of dehydration. We can look at, are you lacking saliva, for example? Does everything look very dry? Just looking at the mucosa here. Okay, you can put your tongue back in your mouth, and I'm going to check your skin. So this, again, very surface level test. But some people, if they're dehydrated, when you pinch the skin, it takes a few moments to allow the skin to go back down. Now mine is pretty instantaneous there. So I'm well hydrated. I generally drink about 90 to 100 ounces of water a day as treatment for a different disease. But you can see that it goes right back down. So if the skin stays tented like that, it's a possibility that we're dealing with some dehydration. So I'm just going to lift and release the skin a few times. Good. Okay, so that looks pretty good. Hydration levels are probably just fine. Now, lastly, I just want to have a feel of your lymph nodes to see if possibly we're dealing with any sort of infection or the after effects of an infection. So sometimes when your body's fighting things off and maybe you don't quite realize it, that can also make us feel a little run down. So I'm going to check from the occipital nodes, the back of the head, around the occiput, and we'll check behind the ears, under the jaw here, the neck, and the clavicle. I'm going to come behind the head here. Good. Okay, and let's come to the back of the ears. Good, in front of the ears. I know you said you hadn't been fighting anything off lately. Just want to double check. Okay, let's go underneath the jaw here for the submental and submandibular nodes here. And then along the neck, we have superficial cervical, deep cervical chain, posterior cervical. All our different neck notes. Good. And finally, supraclavicular above the clavicle here. So we'll just do a little bit of palpation here. Okay. And that seems to be all in order. So that's good. There is a possibility that we have something going on with different nodes. I mean, we have the axillary, we could get into the lower body lymph nodes, but I think for our purposes, and you saying you haven't had any recent illness, that we're probably good on that front. So I have a lot of notes to just jot down. I'm just going to, let's see. Okay, so I think this is something we are going to address with some muscle tension techniques. Now, we haven't talked any about if you had any other symptoms along with this headache. So are you experiencing anything like nausea, or are we dealing with any sort of sensitivity in terms of maybe hearing, taste, smell, things like that? Let me just jot that down. And what about pain anywhere else? Okay, and numbness? Okay. Alrighty, good to know. There's a lot of different treatments we can do for different kinds of symptoms. Some of them, like numbness, for example, it's a little hard to get into. It might be from a pinched nerve, for example. But if we have nausea, we could do an alcohol pad. Sometimes if you smell isopropyl alcohol, that takes away the nausea. Sometimes it's a ginger drop or a mint. Sometimes it's a little bit of vapor rub under the nose. If you have, for example, pain, we could do hot or cold compresses. We could get into some of those pressure points and try to alleviate those. We have different over-the-counter pain medicines, things like that. Okay? All right, so I'm going to start just by warming up the tissues here. And we're just going to very gently just try to introduce a bit of pliability in the muscles. Sometimes they can get so stuck. So we want to open that up. Sometimes just the warmth of working into everything, coupled with the pressure, can help. Sometimes it just distracts. It gives your nerves too many things to try to interpret, and it makes it harder to feel any pain. Get a little more pointed pressure in with one hand at a time. And we're going to get into a lot of different spaces here. So there are a lot of techniques we can use depending on what we're doing. We can use muscle energy, myofascial release, some general massage. action a bit on the neck. Really getting into some of those. I want to bring some fresh blood flow in here. And that can also help a little bit. I know personally I've had some issues in the past with tension headaches that made it feel like my whole hair and head was being yanked up by the roots 24/7 essentially. And a lot of it was caused by having so much inflammation and muscle tension in my neck that it was pinching into my cranial nerves. So I would get trigeminal numbness along my face as well. And with some stretching and a little bit of manipulative therapy, I haven't had those sort of headaches in like 2 years, which is really nice. We're going to work down here. So sometimes it can be a fairly simple fix. Unfortunately, it's just trying to figure out what the issue actually is. That's the more difficult part. There's a lot of different medicines, a lot of different therapies that can be done these days. Okay, so let's get into the back of the head and the neck as well. Warm everything up, and then it'll be much easier to work into. Down into here. Good. Good. And do let me know if this is making it worse at all. I hope you would let me know. When we're doing our diagnostics, that's when it tends to be more of a, oh, does this hurt? Does this hurt kind of thing. But now we're focused on, does this make it better? And right in here. Good. Good. Okay. So I'm going to start with a little bit of stretching here, okay? So if I could have you open your jaw here. Good, just keep it open and close. Let it rest for a moment. Okay, open the jaw. One of my favorite techniques for headaches with the Masseter TMJ issue is kind of a myofascial release technique. And close the jaw, in which you put one of your fingers on the last tooth on the bottom row and your thumb on the canine. Use your opposite hand. You stretch open the jaw. Now with the myofascial release, whoever's doing it with you really gets into the muscles down there, but the stretching part comes from you doing these little stretches a few times a day. But that's one of my favorites. Just getting in there to address those locked muscles and then stretching it afterwards. So if I could have you open the jaw one more time. and close. Right, I imagine that's going to be pretty sore, so we're not going to do any more work with the jaw. We don't want to do any more work that your body can't handle, because then it's not going to feel nice, it's not going to be as therapeutic, and we could be spending it doing techniques that are going to help, okay? So let me go ahead and we're going to warm up a little bit over here. Okay. We're going to create some space. Encourage our blood flow. Good. Okay, I'm just going to sort of stretch the tissues here. Stretch and release. Stretch, release. Okay, and I'm going to do some squeezing. So we're going to do some from side to side and from front to back. So I'm just going to put my hands. Go ahead and squeeze. Squeeze. Good. And release. Sometimes it's just about creating that space in the tissues. So let's do a little bit of work with the neck and some stretching here. So, going back to my personal anecdote, a lot of my problem was also with the AA joint, the atlas axis joint. So that's where your head meets your neck, right in there. And we're going to try to create a little bit of space in here and work with any tension there. Okay, good. Now I am going to have you look straight ahead. You're going to pull your shoulders down, and I am going to take your arms so that we're going to move from side to side, okay? It's very important that you just stay looking straight ahead and that your shoulders are really pulled down, okay? We can even just roll them back a bit, right? And then we'll just very slowly, I could have your arms very slowly work from side to side here. And this can help stretch the AA joint. We want to go nice and slow. It's kind of strange feeling that stretch there. We'll give it just a few more times here. Now I am going to be putting my hand against your head, and I want you to try to move it against my hand, okay? Alright, so I am just going to hold your head steady here. I'm going to put my hand against your face here. And I want you to try to turn. Good. We'll do a bit more. Turn. Okay, a little bit more. just trying to work with the muscle here and get a little bit more movement. Good. Okay. And we're also going to try to build some strength here. So, holding you steady here. And try to turn. And turn. Okay. Turn. Good. Turn. Okay, and turn. Good. Okay. So let's go ahead and move you one side, the other. Good, and we'll go up and down, and we'll tilt to one side, and we'll tilt to the other side. Good, okay, we'll put you back at neutral here. Just make sure that you are all stabilized there. Okay, so let me get into the muscles just a little bit more. And we're just going to try to keep these open. And I'm going to send you home with a few exercises so that we can hopefully build some strength in the muscles so that they don't get so tense, and that the ones that we're supposed to be using are getting used, and the ones that are compensating can relax. And how was all that? And how is your head and neck feeling? The relationship between the two? Okay. Yeah, it kind of feels a little bit of a sort of gelatin feeling after that. And how is that ache? Okay. Yes, our goal is to lessen or ideally eliminate that headache, so I'm glad we were able to achieve that. Do you have any sort of questions for me at all? Okay, so that exercise information, I see that your preferred way of receiving information is email. Is that correct? Can I just grab that from you real quick? Okay. Alrighty, so I will get that to you, and you're going to be doing these stretches ideally about 5 to 6 times a day, which seems like a lot, but they take maybe 30 to 60 seconds each, so they can be fit in while you're just sitting down and eating breakfast right after you're done, maybe while you're watching TV, maybe while you're playing on your phone. These things are pretty easy to work into your day, okay? And I think that'll help a lot with any subsequent headaches. Right, so it was an absolute pleasure having you, I hope you have a whale of a day and many fewer headaches and a good rest of your night. Thank you.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon. Or I also have a Ko-Fi link for a one-time donation or a throne wish list for props and equipment. Thank you again, and I hope you have a whale of a day and a good rest of your night.